there's usually a time lag of just under 300 milliseconds from the peak that you identify at the EKG to the peak that you get from the PPGs. And this time lag has to do a number of factors. First, the electrical activation is the one that generates this signal and this peak wave. And then you have this delay due to the ventricular mechanical, so electromechanical delay. Also, the pulse translate time, basically the time it takes for the pulse pressure to go from the heart to the watch or to the wrist, and then from the deeper layers to the superficial capillary. So this, ultimately adds up to about a 300 millisecond delay. And this delay is sometimes really helpful to kind of extract or derive the blood pressure. There's a time lag between the R wave of the EKG and the peak of the PPG, and that time lag is called the pulse arrival time. And this value is actually a function of blood pressure. And so the higher blood pressure causes the arterial arteries to distend and the arterial wall tension to increase, and then subsequently leads to a higher elastic modulus, or the Young's modulus, which then leads to a higher vascular velocity of the pulse pressure. And so the higher pressures that you have, blood pressures you have, the faster the blood vessel pulse pressure travel, and the shorter time that it takes from the peak of the EKG to the watch. And so this is how you can extract blood pressure using the combination of the EKG and a wristwatch.